Look at our state capitol building, where last week the U.S. House narrowly passed a multi-trillion-dollar Republican budget framework that sets the groundwork for sweeping tax cuts and other components of President Trump's legislative agenda. Today, Erie News Now Washington, D.C. correspondent Brendan Scanlon tells us why some people worry those legislative policies could come at a cost to family caregivers who rely on Medicaid.
In one of his largest legislative victories yet, Speaker Mike Johnson muscled the necessary support last week to pass a budget framework for President Trump's One Big Beautiful Bill. Democrats continue to blast the plan, saying Republicans will need to cut key programs like Medicaid to pay for Trump's tax cuts and other policies.
House Republicans plowed ahead on a morally and financially bankrupt plan to gut Medicaid while cutting taxes for billionaires.
Republicans argue the goal is fiscal discipline and rooting out waste, fraud, and abuse.
No one has talked about cutting one benefit in Medicaid to anyone who's duly owed. What we've talked about is returning work requirements. So, for example, you don't have able-bodied young men on a program that's designed for single mothers and the elderly and disabled.
Leading experts have said that fraud, waste, and abuse doesn't reach anywhere near the $800 billion mark.
But President of the National Alliance for Caregiving, Jason Resendez, worries the scale of the potential cuts would go beyond fiscal discipline.
Less support in your community, less support in your home, and that could result in more folks being institutionalized because there's a lack of those available services that make home and community living possible.
Resendez says Medicaid is a lifeline for the 5 million Americans with chronic conditions, disabilities, and aging-related needs who rely on it for home care services. He says investing in it is not only compassionate, it's cost-effective.
Home and community-based services cost approximately 2 to 3 times less than institutionalized care. So if we want to save money, the smart thing to do is to invest in family caregivers, invest in home and community-based supports provided by Medicaid.
Reporting in Washington, Brendan Scanlon, Erie News.